that is the largest. My second question is, okay, that one really won't make sense until we go to the next slide, the upper respiratory system. So my second question is, what are some of the organs in the upper respiratory system now that we've talked about them? What are some of the organs in the upper respiratory system? We have the nose.
Larynx.
Yes. We have the larynx, we have the pharynx, we have the nasal cavity or the nose. We have the nose, the nasal cavity, pharynx, and larynx. Yes. So we want to talk about the upper respiratory system. We did talk about it yesterday, but for the sake of those who are not there now that we also didn't record the session, I was persuaded to repeat what we discussed yesterday. And so this one here is the external structure of the nose, the external structure of the nose, which we got to explain. So I told us that there is some part that there are certain parts that we should always know. On your left, the lowest, the one that is below, the last naming, that is the philtrum. The philtrum. On that area, there are certain procedures, or rather, there are ways we normally do some treatments on that area. Mostly when it's, let me say, emergency treatments. The emergency treatments that can be always done in the philtrum area. Let me say when someone has an asthma attack, we can always apply some eucalyptus or peppermint oil. Peppermint oil is the best in opening the pulmonary airways or the pulmonary passages, peppermint oil, but eucalyptus can also do. It will always help. So whenever somebody normally has an asthma attack, we can always apply that, either of the two essential oils on the philtrum. I believe you can see my, I'm seeing it. I believe you can see my cursor or the pointer. And then there's an opening here called the nares. The two are called nares. That nares when there are many. Nares when it's one. This opening here, this is known as the nostril. And then we have the ala of the nose. The ala of the nose. When you look at the ala, there's this word ear cartilage. There's this word ear cartilage and dense fibrous connectivity tissues. So just below the skin, on the ala of the nose, we have these two tissues. These are connective tissues, cartilages and these fibrous. These fibrous connective tissues. These are connective tissues. They bring cells together and connect them. They are normally firm and flexible. That's why you can always expand and contract the ala of your nose. So that place there is called the ala. Yesterday, I emphasized on the root of the nose, that we should know the root of the nose, because it's very important to us to know. So the root of the nose, you see this frontal lobe bone, the bone that is just in our frontal lobe, the bone that protects the frontal lobe of our brain is called the frontal brain. And then just below the frontal bone, we have what is known as the nasal bone. So the frontal bone, it more of circulates the nasal bone, and that is what we call that's what we call the root of the nose. and so on and so forth. So we have the nasal cavity, which is just below the ala, or inside our nose. This protrusion here is called the nose. This whole thing, I believe we know that. So below that, we have what is known as the nasal cavity. I believe this picture explains it better. We'll look at it when we get there. So the nasal cavity, the air-filled space behind the nose that I've said, and then it is divided into three regions. We have the vestibule region, we have the respiratory region, and as I was saying yesterday, in the respiratory region, I believe you can see the respiratory region where my cursor is moving. This part shaded brown, I believe that color is brown. So in the respiratory region, we have what is known as respiratory epithelium. It has a name, a very difficult name. It has a name, pseudo something. And in this region, in the epithelium, we have the respiratory epithelium. We have cells, several cells, because it is cells that makes up a tissue. And epithelium is a tissue. So we have several cells, and one of the cells that are there is the the goblet cell. And we know what the goblet cell normally secretes. We saw that in the digestive system. It secretes mucus. So in this respiratory region, there are lots of capillaries that supplies blood there. There are lots of capillaries. And so what normally stimulates mucus to be produced is what normally stimulates the mucus to be produced either in large quantities or in small is the amount I really don't know how to put this in English, but let's say if the capillaries or the blood vessels that are in the respiratory region are less stimulated by the type of air we breathe. We can breathe hot air, we can breathe cold air, or we can breathe either hot or cold or air that is just in body temperature, and that is what stimulates the vessels. So when the air is too cold, then the vessels will be greatly stimulated, and in turn the vessels will stimulate the goblet cells to secrete mucus, so that the mucus can help warm this cold air that we are breathing, can help warm. If we breathe in air that has a lot of I don't know the English term for it, but let me just use a Swahili word. If the English term comes, I'll use the English term. So the Swahili word is also going. But when we breathe air that has the Swahili word is vumbi. So if you can kindly remind me of the English word of that word vumbi, if
dust.
Yes, thank you, dust. So when you breathe a lot of dust, then the vessels will as well be stimulated to produce mucus. There are other regions that can be stimulated, there are other factors that help stimulate the goblet cells so that the respiratory system can be protected. We have the airs here in the vestibular system. The vestibular system is the green part. That is where we have the air. And when you put your finger, be it the small one or even the bigger finger, when you put it inside your nose, the very first region, the region that has that soft part, before the region that is behind the hard part is called the vestibule, and it is the region that has the air, and the mucus that is produced in the respiratory region can also get down to that place. And then we have the olfactory region, where we have the olfactory nerves. olfactory region, we have the olfactory nerves, and we say that this bone here that is just above the olfactory region, it has some openings where the olfactory nerves can pass through and directly get connected to the brain stem, get connected to our brain, so that smell can be induced, so that we can just have that sense of smell. And then we have the auditory tube. It's an opening to our ear. This one here, it's called the eustachian tube. It's more of an opening to the ear. But what we wanted to look at here is the three parts of the nasal cavity. The three parts of the nasal cavity, which we've seen. So the functions of the nasal cavity, I've mentioned a few, and you guys have mentioned warm or cooling of air, which we've seen is the mucus. The mucus helps in that. Humidifying the air, the mucus helps in that. That is, humidifying simply means moisturizing, and then it trapping dust, pathogens, and other particles. The air and the mucus partly helps in that. So this protection is done in a physical manner and also immunological ways. We'll see how it's done, how this protection is done immunologically in the trachea. Sense of smell I've talked about. So the second part of the upper respiratory system, immediately air passes through. Oh, there's something I've really not mentioned, by the way, in the respiratory region. Today I also didn't put the slides. It's so unfortunate, but it's fine. Let me just mention it here. Do you see these folds where there are three? We mentioned them yesterday. Conchae. So we have this lower one, we have the middle one, and then we have the superior one. Superior, middle, and then lower, conchae. So when we breathe in our air this way, this region near the conchae, conchae, it helps to propel. Not really propel, but it more of works as a whirlwind. It circulates the air that we breathe here. It circulates it to give it room to interact with the protective mechanisms that are in the nasal cavity just before it goes to the pharynx. So the pharynx, not pharynx. Pharynx is subdivided into two. We have the nasopharynx, we have the oropharynx, and then we have the laryngopharynx. Laryngopharynx is just posterior. Let me start with the oropharynx. Let me start with nasopharynx. So nasopharynx, it is posterior, it is behind the nasal cavity. Naso here simply means nasal. So it is posterior behind the nasal cavity. That's why it's called the nasopharynx. Pharynx simply means the throat. And so this one is just the throat that is behind the nasal cavity. Oropharynx is the throat that is behind the mouth or the oral cavity. Oropharynx is the throat behind the oral cavity, and then laryngopharynx or larynxopharynx is just the throat that is above the larynx. So what are some of the functions of the pharynx? It guides air into the trachea and food into the into the esophagus. We'll see how epiglottis helps, and it has some role in speech. This part here is called the epiglottis. This one here. So the epiglottis, when you are eating, you know this system here. This one here is the larynx. This one here, it's just above. Let me see if I included a slide that would. Okay, I didn't include a slide that would help us explain that. But this one here. This one here is the larynx. So this one is the epiglottis. I believe you can see my slide. If my pointer, if you're not seeing my pointer, you can tell me. So this one here is the epiglottis. So the epiglottis, it closes when you take your food, when you chew your food here. This organ here is the tongue, this one here, where my pointer is moving. This one here is the tongue, and the whole of this is the mouth. There's a bone here, and what's the name of the bone that separates the mouth and the nasal? Because there's a palatine bone. There's that bone that helps separate the nasal cavity and the oral cavity. This bone here. So this is the tongue. So when we eat our food, this epiglottis will close the trachea so that food can get into the esophagus. Esophagus is posterior the trachea or behind the trachea. The trachea is in front. This one, the whole will see it, and then the esophagus. When breathing in, it will close the mouth so that air can be directed into the pharynx. Into the larynx. So this one here is the larynx, and it's commonly known as the voice box. Can somebody tell me what this organ is? This organ that looks, I really don't know what this shape is, but it more of looks like, where my cursor is moving. Can somebody tell me what this organ is? Can just unmute.
The thyroid glands.
Thank you. That is the thyroid gland. So it can always swell, by the way, but we'll talk about the thyroid gland when talking about the endocrine system. We'll talk about it more and deeply. So for now, we'll just remove it and get to this other image on the right, where my cursor is dancing. So the voice box is known as the larynx, and what's its location? It's positioned between the root of the tongue and the upper end of the trachea. This part here, you see this part here? Are you guys seeing where my cursor is moving? This part here, this one is the trachea. Yeah, thank you for the response. This one here is the trachea. This one is a clavicle bone. So this one here is the trachea. This one. So just above the trachea here is where we have the larynx. You can always you can just touch it. It sits on your neck. The Adam's apple is. Guys call it the Adam's apple, the voice box. So this one here is the larynx. The larynx. That's its position. So let's see the anatomy of the larynx. So we saw that there is an epiglottis somewhere. And what role did I say is the epiglottis used? What role does it play, the epiglottis? Okay, it's fine. So, yes?
Epiglottis helps actually prevent, or like it helps to balance whether the trachea flow or the air box, not the air box, the food entering into the stomach, that is the GIT tract, or the air side. So it helps to regulate the two, so that if it's air, inafaa kuingia the trachea. If it's food, then it should get into the GIT.
There's a reason why I'm stressing on the epiglottis. There's an inflammation that is related. There's an inflammation. The epiglottis can get inflamed and swell up. It's normally considered as an emergency because the epiglottis is a very important organ in our body. When it swells, it can block the passage, and even if you use the essential oils, the peppermint or the eucalyptus, and put it in the philtrum area, it won't really help in opening the pathways. So it's very important for us to know what really is blocking the passages, or rather the airways. So the epiglottis, when it swells, it's normally considered as a medical emergency. But I believe Elisha will look at that when talking about the diseases. So the epiglottis, I think that's the most important thing that we should look at here. But you guys should know this anatomy of the larynx. You can just know how these things are placed. Unless you want to learn to do surgery, you can learn everything here, actually, the names of everything, even if you don't want to learn how to do surgery, but it's very important to learn their functions. So this is where the thyroid sits, the superior thyroid notch. This place, this is where the anterior, or in front of the trachea. And then anterior simply means the front view, posterior simply means the behind view. So we can see the trachea here. I'm mentioning the trachea and all these other things so that when we get there we can move fast. Today we really won't extend time. So trachea, we see there are C-shaped structures here called the tracheal cartilages. A cartilage is simply a connective tissue. Connective tissues, I told you, they are firm, they are flexible. So here we have the tracheal cartilage. They are C-shaped. That is the anterior view. When you look at the trachea from behind, that is, look at my cursor. It's on the second image of the head of this man. So when you take a picture, when you take an X-ray or an imaging from this back side, the back side of the neck, then this is what we'll see on the larynx. This is what we'll see when we look at it this way, front side this way. When you look at it this way, where my cursor is dancing, we'll always see this front view or the anterior view. When we look at it from the back of the neck, where my cursor is dancing from the back of the neck, this is what we'll always see. When we look at it from the side of the neck and cut it, this is how we'll always see it. So from the back of the neck, you see that these cartilages, these C-shaped connective tissues, they are not complete. They are not complete. And why are they not complete? Why are they not complete? I told us that just behind anterior, I really don't know why I didn't include that most important slide, but let me use this one. You guys can see where my cursor is dancing is the esophagus. Someone to kindly just say they can see it, where my slide is dancing.
Yes.
This is the esophagus. So it's here. The esophagus is here where my pointer is running. So you can see that it is behind the trachea. So they are more of connected. I included the slide, I remember. This is it. So this one here is the trachea. This one here is the trachea, the C-shaped. This one here is the trachea. So when you look at it from front, that is the anterior. Look at this compass here. So from the front, anterior ni uku. So the C-shaped are this way. And then just behind the trachea, we have the esophagus. And so the reason why God made these C-shaped cartilages not complete is to allow the esophagus to easily expand and contract when what happens when we are swallowing. When we'll be talking about difficulties in swallowing, we need to know how that can occur. Difficulties in swallowing whenever there's an inflammation. Maybe the trachea is becoming constricted, or maybe there's an ulcer, and the rest. So it's very important for us to know how the body functions normally, so that we can tell what is happening when the body is functioning abnormally. So that's the reason why God created. That's the reason why God created the tracheal cartilages to be incomplete, so that the esophagus can easily contract and expand when we are eating. So these are some of the upper respiratory infections, and those are some of the common symptoms that we can always attach to them. So we are done with studying the upper respiratory system, and those are some of the diseases that we expect to cover. So the diseases of the respiratory system can always be grouped into two. We have the obstructive from the word obstruct, and then we have the restrictive. We'll measure on the obstructive, those disorders that obstruct, or rather obstruct the passage of air. We'll majorly dwell on the obstructives. So I just placed them there so that we can know what to expect to cover in the upper respiratory system. So when we talk about epiglottitis, that is the inflammation of the epiglottis, we know where the epiglottis is in the body. So when we talk about the inflammation of the epiglottis, we can clearly tell when a patient presents to us, when a patient tells you that I'm feeling, I feel like my neck is painful, and or rather inflamed or itchy, whatever it is, you'll always know where the itchiness or the inflammation is coming from mastering the anatomy of the head and throat. The anatomy of the head and throat. So this is essentially what we've talked about. We've not talked about the paranasal sinuses, but we've talked about the nose, we've talked about the pharynx, we've talked about the larynx, larynx, we've talked about the trachea. So let's get to the lower respiratory system. And my question...
something, please.
Yes, go ahead.
Yeah, you talked about what happens when cold air enters the nasal cavity, you said, and then it stimulates mucus. And then you started talking about hot air. I don't know what happens. Is it the same reaction? When it is hot air, is it still mucus secreted? I want to understand that, please.
Okay, thank you. So yes, mucus will be secreted, because it's the mucus that will help lower the temperature of that hot air, and also aside from helping lowering the temperature, it will help to moisturize so that it can be propelled. But there are certain mechanisms that are placed by God in the nasal cavity that will always prompt us to look for, like, they'll always make us not comfortable in such conditions where the air is very hot. So those are some of the protective mechanisms. You'll always try fanning yourself, or putting your nose, if it's in a car, putting your nose outside or opening the window. You'll always feel discomforted. But mucus, yes, it will be produced. I believe that was answered.
Yes, thank you.
I have a question.
Yes, go ahead.
Sometimes when you breathe in cold air, you find you can nosebleed. What happens with that?
Okay, what happens? You can nosebleed. So, as I said, in the nasal cavity, we have blood vessels in the nasal cavity. Let me just look at it. In this respiratory region, we have blood vessels, and we have some 3 systems here that causes a wave in our nasal cavity. We have 3 systems here that causes a wave in our nasal cavity. So if your epithelium cell, the mucosal epithelium cell that helps the very first lining in the respiratory system or in any system is normally the epithelial cell, and internally it's normally coated with mucus, a protective layer mucus. So if that protective layer is somewhat affected, if the protective layer is not functioning, or if it has been eroded by maybe, let me say, smoke, or if the goblet cells are not secreting enough mucus, if that protective layer is weared out, then when air will be whirling, when the air will be rotating, there is a turbulence that is normally created here. So it can inflame or hurt the vessels, the blood vessels that are there, and that could cause nose bleeding.
Okay, thank you. And that one also happens when what is it called? When you try to blow your nose so many times, it can also affect the respiratory region.
Well, about blowing the nose, mucus can always come from anywhere, from the bronchus, from the trachea. So when you blow your nose and you find the mucus coming out with blood, then it's normally not conclusive to say that it's originating from the nasal cavity, but mostly mucus coming from the trachea, the bronchioles, they normally come out from the sputum, from the mouth mostly. So when you realize that there is blood coming from your nose, then the vessels have been compromised in a way. We look at the pathology and see further. Though we really didn't include, let me see the disorders that were included here. Sinusitis, it really can't happen there in the sinusitis. So, yeah. But we'll look at all those questions in detail when talking about the disorders or the pathology of these vessels. I really don't know if your question was answered, but it's not always conclusive to say that the blood is only coming from the nose, because as I said, we have some openings here. I said this bone here is called the ethmoid bone, and we have cribriform palate. We have this bone here, the cribriform palate ethmoid. We have some openings here that can lead to they lead into the cranial cavity. The cranial cavity is where the brain sits. So it could also just be some bleeding. You could be bleeding internally in the cranial cavity, or internally in the cranial cavity without knowing, maybe. So it's normally not very conclusive. So I believe that was answered.
Yes, thank you.
Yeah. So what are some of the lower respiratory tract organs? Someone to give us examples. I can see I have only 10 minutes to conclude today's class. And how many slides are there to go? This is eight slides to go. Someone to give me examples of the lower respiratory tract organs.
The lungs, the bronchioles, the bronchus.
Okay. So we'll start with the trachea. It's the very first organ in the respiratory system. In a layman's language, it's called the windpipe. The windpipe. So those are some of the functions. We've seen the trachea, actually. Those are some of the functions. And where is it located? It is located behind the medium sternum this is the medium sternum. This one here. So it's located anterior behind the medium sternum. This one here is the medium sternum bone. I believe you guys can see my cursor. When I say here, I am referring to the cursor moving. So it's located behind. I believe we'll have a privilege to see a few X-rays, and we'll learn how we can read the X-rays. And when talking about certain diseases like pneumonia, TB, I believe we'll learn how to read the X-rays and tell if someone is suffering from TB and the rest. So this is the medium sternum. So the trachea is located behind it. And some of the functions of the trachea, I want you guys to listen to me here. I believe we've read. So some of the functions of the trachea is it carries air. This is the main function. It carries air in and outside the lungs. It carries air inside the lungs. It carries CO2 outside the lungs. That is the main function. And some other functions are protective. It has a protective mechanism, which I said mostly the protective mechanism could be either physical or immunological, because there are certain pathogens are disease-causing organisms. So there are certain pathogens that can always be inhaled into our respiratory system. And the immunological mechanisms can always help the trachea to propel them out to the larynx to be expelled out of our system. And physically, we have goblet cells. We have respiratory mucosal lining also in the trachea. Let me show you guys the cross-section on area of the trachea. This is the anatomical view cross-sectionally of the trachea. So the very first section, this inner one, I believe you can see my cursor moving. This inner part, it's the mucosal or the mucus layer. The trachea has 4 layers. It has 4 layers. The first one is the mucosa or the mucosal layer, and then the last one is the adventia. This one here, adventia layer. That is the last one, and this is where we have the C-shaped. This layer here, this cartilage just before the adventia, the last layer. This is where we have the C-shaped cartilages that helps to keep the trachea open. Actually, the C-shaped organs specifically helps to keep the trachea open. So here we have a mucosal lining, and it has goblet cells that secretes mucus. It has goblet cells that secrete mucus. And the mucus helps in, number one, it helps in warming, it helps in moisturizing the hair. Aside from that, we have some cilia. Cilia are more of like air. So we have aerated, not really aerated, but a lining here called ciliated hairs in the mucosal that helps propel, or rather, they help propel the foreign particles upwards for expulsion. So, some other thing, there is something called the cilia. There's something called the mucociliary rejection. And when you normally breathe something in, there's something that has been sent in the group. Let me see. When you breathe air in, when you breathe, let me say, okay, when you breathe vumbi in, there are times that you'd cough. There are times that you'd cough. So the ciliary, the air here that is called the ciliary inside this mucosal coat, they have some mechanism called the mucociliary rejection. It helps. It's normally facilitated by coughing. So that's what helps expel the foreign particles upward when you breathe a lot of vumbi. I really don't know why I'm forgetting this word vumbi in English each and every other time, but it's dust. So when you breathe a lot of dust in, when you breathe foreign particles in, at times you'll always feel irritated in the throat or in the chest, and you just above the chest, and you'll always feel like coughing. So the mechanism that helps in that rejection is the mucociliary, and it's found along the mucosal lining of the trachea. So that's how the trachea functions. I talked about this function here in box, this one here in a square. I talked about it, so we just move on to the next. And from what you guys can see, let's talk about the bronchi and the alveoli. So the bronchi, it separates. The trachea separates into two. The trachea separates into two primary bronchi, and we have the right bronchi. Just look at this diagram. The diagram on your left. We have the right bronchi and the left bronchi. So we've said that the trachea. Look at my cursor. This part here. I believe you can see my cursor moving. This part here is called the trachea. So there is carina. There is some part here called carina where the trachea divides into two. The trachea divides into two, and when the trachea divides into two, we call the two primary bronchi. The two. If it's one, the primary bronchus. So the right primary bronchus. Look at my cursor. The left primary bronchus, this one here, it's larger than the right, not really the left, but the right one. This one here. I'm talking the right main bronchus. This one here, it's primarily larger than the left main bronchus. And that is what has been written here, is slightly larger, and then it's more vertical. I've placed a picture here to help us describe what vertical is. To mean it's more of straight. So when we breathe in debris, when we breathe in certain foreign particles that cannot be propelled outside by the mechanism that I've talked about, that is facilitated by coughing. The mechanism is mucociliary rejection. If there are certain particles that cannot be expelled outside the very first place that they will always get inside is this bigger place, because it is more of vertical and it is large. So that would always help us tell when someone is saying that I have a right chest pain, though that's not the only clinical feature that you can always tell and know, or rather, you can always tell when someone has a right back pain. Like, that's not the only diagnosis, but it is part of. So mostly, I'm not saying it can't get inside the left bronchus, but it is highly it will highly get into this large part, this part that directly is vertical to the trachea. So look at this one. Look at this one and take that to the bank. So the bronchi is the very first division is called the primary bronchi, and they can, when the primary bronchi branch, they normally branch into three. They normally branch into three secondary bronchus. They normally branch into three secondary bronchus. The primary one normally branch into three, and then the secondary bronchus further branches into tertiary bronchi. It further branches into tertiary bronchi, and the tertiary bronchi further divides into. Just look at my cursor. It further branches into bronchial. So the bronchial also further divides into primary bronchial, secondary bronchial, tertiary bronchial, and we have 23 divisions of these bronchi and bronchioles all put together. We have 23 divisions before we get to the alveolar. So in the alveolar, that is where now respiration takes place. That is where now gaseous exchange takes place. All these other organs that we've talked about, they're just used as conduits or passages for air to the needed location. And the location where they're needed is the alveoli. So tomorrow this is it for today. They are needed into the alveoli, and this one here is the alveoli. So this one here is the alveoli sac, alveolar sac. Just look at my cursor, alveolar sac. That is a group of alveoli. When grouped together, they make the alveolar sac. So this is the alveoli. This is the alveoli. So that is the passage that air takes all the way to the respiratory system. That is the passage that air takes. So tomorrow when we get here, in our next class tomorrow, we'll essentially start looking at the functions, or rather the processes that are involved in respiration. We'll first look at the lung, the alveolar, and then look at the lungs, then look at the thorax, then we'll start now studying the physiology. So unless maybe someone has a question, I'll rest my case there. Any question? Okay, let's kindly say a prayer as we close. Lord of Lords, we thank you for being with us throughout today's session. May you continue expanding our knowledge in what we've learned. May you push us, Lord, to study further so that we can be more efficient in doing this work for you without putting in a lot of idleness and jokes in matters that involves human life. May you instill in us seriousness as we continue jealously guarding this desire that we have to learn and study our making, to learn and study, Lord, how our body functions normally and abnormally, so that we can always put it in the best position to serve you best and also to minister, Lord, to your people in the most effective manner. May you be with us as we depart, is my prayer, trusting and believing in Jesus' name. Amen.
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 Nikuulize, umeifunga the video? Because you know I was streaming.